If you've ever had kidney stones, you know it's not just back pain. This is Dr. Shirley Veronica Choka, and this is your ultimate UroGuide. Today we will look at kidney stones, what they are, why they come about, and how we usually solve these issues of kidney stones. A kidney stone is a deposition within the kidney, the ureter, from the word itself, the kidney. However, it can also involve the ureter, or you can have stones in the bladder, the urinary bladder. So how do these kidney stones come about? Kidney stones come from deposits within the urinary system, such that we all know that the kidneys are responsible for washing out all the residues from your body. So sometimes because of either dehydration or an increase of these sediments, you have them deposited somewhere within the urinary symptoms. So what are the risk factors? Dehydration, lack of hydration, is the number one risk factor, and where you have a family history of the same, or where you have this deposit either in excess in your body for one reason or the other because of the difference in metabolism within the body. So what are the symptoms? How do you know that you have kidney stones? Number one, the pain that comes with it. Once the stone is deposited within the system, trying to move, because it's a foreign body within the urinary system, any movement of it within that tiny tight space causes a lot of pain. So number one, you'll have severe flank pain. Severe flank pain refers to pain on the sides or the groin, and you might sometimes feel that it's radiating down to the scrotum for some men depending on its position. Sometimes if there's an infection, you'd spike a fever, you'd have nausea and vomiting, and sometimes you might see blood in urine from the irritation of the tract as the stone moves through the system. So these are some of the symptoms that you'll be able to pick up. How do we manage this stone? So you've come to the hospital, we've seen your symptoms, we know there is a stone. We send you for a CT urogram. This is an image of the system that shows us where the stone is exactly, what the size is, how hard is it, so it can help us in the management. So the management really is based off the size of the stone and its location, and the involvement in the system and how your anatomy looks like, essentially. So if it's a small stone, the really tiny ones usually pass. They pass with a lot of pain, but they do pass. But there are stones that won't pass through the system because of how the anatomy is. So when it is big, there's the cutoffs. There are different cutoffs we give for the different stones. So there's surgical interventions for them, and we are lucky enough that nowadays we don't open up the patient to remove the stone. There's minimally invasive surgery where we use endoscopes to access the system up to where the stone is, so that we use laser technology to laser the stone, and so that it's fragmented and cleared out of the system through your urine. So key information here: for prevention, drink a lot of water. Make sure once you're a stone former, you're being followed up aggressively by a urologist so that they don't recur again. If you have family history of the same, you're at a high risk, so keep that in mind and get yourself checked early enough. The other thing is, for most people who have prior history of stones, there is a high probability that there will be recurrence of the stone in the system. So it's important to be very vigilant about it. The simplest way to prevent stones is hydration. Hydrate, keep those kidneys filtering, and enough water will prevent sedimentation of this particulates in the system. This has been Dr. Shirley Veronica Choka, and this is your ultimate UroGuide.